Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. August is National Overdose Awareness Month, a time to remember those lost to overdose, provide space for grief, connection, and healing, and highlight the work happening in our community to prevent overdose and support recovery. Throughout the month, we're featuring organizations across our community that work to prevent overdose, support recovery, reduce stigma, and connect people with care. Today, we're joined by Hannah Groves, Director of Community and Systems Engagement, Brandi Drtina, a project supervisor and certified peer and family specialist at the North Colorado Health Alliance. Thank you both so much for joining us.
Thank you for having me. So Hannah is my boss, and Hannah was like, "Hey, Brandi, and this was something that I really respected." She was like, "I can answer all of these questions in this interview, but I really don't feel comfortable answering all of the questions around substance use. Like, I would rather it come from someone that has lived experience." I really respected the fact that she asked me to step in. Barely found out about this yesterday morning.
Yeah.
So, yeah. And then I was like, oh my gosh, I don't know. Am I going to be on video? Like, oh, I didn't do my hair. No, I'm just kidding.
Can you just tell us a little bit about yourself and the work that you do at North Colorado Health Alliance?
Sure. So I started my career at North Colorado Health Alliance about 5.5 years ago. I entered fresh out of addiction. And so I started off as a peer. And since then, I've moved into peer supervisor roles, so really kind of supervising our peer specialists in Larimer, Weld, and the Eastern counties. And since then, I've moved into a project supervisor role. So what I get to do now is really offer professional development and leadership opportunities to peers in the workforce in Northern Colorado.
Can you tell us a bit about North Colorado Health Alliance and the work that you do?
Yeah, so North Colorado Health Alliance actually started in the early 2000s. So we're actually celebrating 25 years next year. It was founded during a period of significant change in healthcare and public health systems. And so regional leaders really came together around simple but powerful idea, which is that by sharing resources, communities can solve challenges more effectively. And so we find that is still true today. And NCHA is still very relevant. And we're actually leaning into a lot of those collaborative mindsets and needs from which we started. And then we really have just sprung from that idea and added services and added specific things to meet community needs. Especially now we're leaning into collaboration, and partnerships are really where things happen.
And what regions in Northern Colorado do you serve?
So we serve Larimer, Weld, and then a bunch of the Northeast counties. I believe there are 13 that we serve. And so we're really interested in this whole little corner from Larimer to the east. We're really interested in supporting rural communities as well, because they do have limited access. They have fewer resources. And so we're really interested in extending our services as far as we can into the northeastern communities as well.
What work does North Colorado Health Alliance do around substance use?
So we provide quite a few services, both direct and indirect. Our most direct service is our addiction response team. So these are folks who are peers, peer recovery specialists, and who are care coordinators. So their task is really to meet people where they're at, wherever they are in their substance use journey or their recovery journey, and just walk with them along their journey. And so that means that they can show up at emergency departments. They can help guide people towards resources. And the power of peers is that they've been there. They are all in recovery themselves. And so it's a really powerful way to honor people's consent and where they are and choice in how they want to maybe walk through recovery, or maybe they're not ready yet, but they just need someone to talk to, someone to listen to them. So that's a huge part of our work, is this addiction response team. We also have other supportive services like our care management team. It's really important when people are needing any sort of help with their health care, which includes substance use disorders, or looking for treatment and recovery services, that they have access to health insurance, that they have support with, some basic needs, housing, transportation. We can't fix those things, but we have folks who can really help people access things that they may not be aware of or help make a phone call that can get someone onto a wait list for housing, as an example. We also have other direct services that might help people, including our harm reduction work and our overdose prevention work. So across the whole region that NCHA serves, we have Narcan kiosks and harm reduction vending machines at key locations.
Can you describe what Narcan is and what it does?
Yeah. Yes. Narcan is actually, it's called several things. It can be called Narcan, which is the brand name. Naloxone is the actual kind of generic name, but it is a nasal spray that is a life-saving medication to reverse opioid overdose. So for the nerds out there, you give someone a nasal spray of naloxone, and it actually binds to the receptors in your brain that the opioids are bound to and causing the overdose, and it kicks them off and binds instead. And so when people come out of an overdose, they feel really, really bad. And that's because of that kicking off and the rapid decline in the brain chemicals that happens as a result. It's available over the counter and for free through NCHA and other folks who are able to distribute it.
Can you talk about what harm reduction is?
Yeah, so harm reduction is really reducing the harm of something, right? So in the substance use realm, we talk a lot about harm reduction by using tools. So naloxone, fentanyl testing strips, getting folks access to the things that can make substance use a little bit less risky.
At any point, people can look on our website. We have a map of where all the vending machines and kiosks are, and they can actually go and get Narcan and fentanyl test strips. And in terms of indirect supports, we are always interested in working with our partners to co-locate services so that, if someone is dealing with substance use disorder or needs help in that way, and they're maybe presenting to the emergency room, or maybe a co-responder program is where they're first interacting with some folks who can help them. NCHA is really interested in building those partnerships so that our team can kind of respond where they're at instead of them having to come to us. So in terms of our indirect supports, we're always interested in partnering better, thinking through like where people really are needing help or services and being there to meet them wherever that is.
What drew you to work in public health and substance use in particular?
I'm a very values-driven person. My values are community, connection, and joy. And I strongly believe that I am deeply connected to everyone in the community, even people that I've never met yet. And so I think that I was drawn to public health because it's a way to be in community, to build connection, and for me and others to experience joy. Because if you're thriving, if you're able to get your basic needs met, if you're able to get the health care that you need, you're more likely to have a really good life. And I feel like fundamentally everyone deserves that. And so I would say that generally that's why I was drawn to public health. And then specifically, I've been in the community, based mental health and substance use field because that's where a lot of our need is. A lot of people, like I said, are experiencing it. And I just think that that's where a lot of my time and effort have been spent because that's where it's been needed.
I'm actually a person in recovery myself. And so I did a treatment court program, which is probably where I really became passionate about helping people along their substance use journey and recovery journey. I graduated the Weld County Treatment Court program in 2020. And so in that program, I really felt supported by like a collaborative approach. In treatment court, the judge, the treatment team, the DA, the public defender's office, they really surround you and try to navigate the support that's going to work for you for your recovery. And so really finding that collaborative approach for my care that I needed, and then connecting with people that were like-minded. So people that were going through the same struggles that I was going through. So that really made me passionate about wanting to become a professional in the world of recovery. I wanted to be loud and proud about, that if I can do it, then anybody can really do it. So a friend of mine told me, hey, North Colorado Health Alliance is actually hiring folks like us. And back then we weren't even called peers. We were actually hired as community champions. But this was like kind of fresh in the peer workforce time. So that's how I learned about North Colorado Health Alliance.
Your title, the Certified Peer and Family Specialist, can you tell us a little bit about what that is, that certification?
Yeah, so that is the credential that Colorado uses for peer support. When somebody has interested in stepping in this role as a professional, They can do some core training to learn how to really support folks that are struggling with substance use by using their lived experience. And along the way, they have to get supervision hours and work hours in order to obtain their credential.
So, Brandi, can you describe for us what exactly is substance use disorder?
Yeah, so for me, substance use, like from a lived experience point of view, substance use kind of feels more like a label that's put on someone for something that people think they're going through, right? Substance use usually is like a visible way to describe something that someone's dealing with invisibly. So when folks struggle with substance use, recovery usually feels like it's impossible to obtain.
There is no one definition. I'll say that it is a diagnosis, or it can be a diagnosis. Sometimes people self-identify. Substance use disorder is essentially any time that a substance is taking over someone's life and creating negative impact. And do I feel like I need help in this area? Substances can also be anything from alcohol. It can be prescription drugs. It can be illegal drugs. It can be basically the gamut. And so a lot of people can either identify with an actual diagnosis and need that or want that in order to access treatment and other supportive services. And some people will never want to identify with their diagnosis or with having a substance use disorder.
That's where a lot of the times peer support can come in handy. We can step in, folks with lived experience can step in and connect with someone and really try to help them, show them from a viewpoint of I've been there, done that, and really kind of navigate the things that could help someone be successful.
What does that peer support kind of look like?
So the North Colorado Health Alliance, what we really try to do is connect with folks where they're already receiving services. So a lot of our folks are embedded in places like clinics, hospitals, day shelters, things like that, where folks are actually going to get support that they need already. And so we really like to be there and connect with them then. What a peer usually does is kind of just connect with a person, develop relationship, and really find out what a person wants to work on. So a lot of people assume that recovery can look one way, and a lot of the times it looks a lot of different ways. So what works for me might not work for you, Joanna, in a recovery like mindset.
What are the eligibility requirements then for peer support?
So actually for us at the North Colorado Health Alliance, there really isn't any real eligibility marker for folks. If they just want to work with us, that's really the only eligibility requirement that we have.
So can you share with us some of the risk and resiliency factors that influence substance use and overdose?
Well, a lot of the times it's things that probably people already assume could cause someone to struggle in life. So like trauma, stress, loss of a loved one. A lot of the times it can also be like being misdiagnosed with certain mental health conditions. And so really anything can drive someone to use substances or to go back out and use substances again.
Yeah, this is really person dependent as well. Like, for example, two people from the same family, they might have the same risk and protective factors, and one person might develop a substance use disorder and one person might never touch any substances. It just kind of depends. But some of the risk factors that we see is it can be genetics. A lot is with your environment. Were you exposed to substances? Did you watch your parents drink alcohol from an early age? Did you have access to it? So there's genetics, environment. There's also social determinants of health factors, where you grow up, what you're exposed to, even outside of the home can really have an impact. And then we also see, trauma or other mental health issues can be risk factors as well. A lot of substance use is maybe self-medication or trying to make things or thoughts go away. And then resilience factors is kind of a lot of the opposite. A lot of times people in this field will say connection is the cure. If you have supportive relationships, if you had, different models growing up, like you didn't see a lot of substance use, you may be less likely to develop a substance use disorder over time.
What does the current landscape of substance use then look like in Larimer and Weld County?
Larimer County in particular has shown how much they value mental health generally in how they've voted. They did vote a couple years ago to pass a bill that then actually funded a lot of mental health supports, including Longview. It's interesting because there is a difference between where the focus is and where there's funding and where there's still issues in our community in particular. So What I mean by that is there has been a lot of effort, energy, and funding around opioid use disorder specifically. And so there's been a lot of good that has come from that. So I feel like in terms of the landscape, we're able to raise awareness around opioids. We're able to provide Narcan and some other really supportive things to saturate the community as much as we can with these life-saving interventions and medications, as well as some other supportive services. That being said, there's still other substances that are quite common in our community, in particular alcohol. Alcohol is still almost the number one used substance. It's also more socially acceptable, especially Larimer County, Fort Collins very much has a brewery and bikes culture. Socially and culturally, people don't see drinking beer as a problem, but that can actually really still develop into a substance use disorder, once again, depending on how the person is using it, how they feel about their use, and also how it's impacting their lives, their health and safety, and others. We still do see different types of substances used throughout Larimer County, and there are resources for all of them, but I would say we still have a lot of work to do when it comes to alcohol use in particular in this community.
How has your approach to substance use and treatment evolved over time since NCHA was founded?
I have a very small picture of the 25 years of our history, but the truth of it is that substance use continues to be an issue. It might change. There might be different ways that we're funded. There might be different initiatives that receive more attention over time because of singular events, because of trends over time. But until the conditions of our nation are ones that people can thrive, we are going to continue to face substance use challenges, and people are going to continue to use drugs. And so how do we make sure that people have the resources, the education, and the services that they need to be kept alive, to be kept safe, and maybe when they are ready for recovery and treatment, that we're there for them, because it can take people quite a while or never to be ready for those services. And we want to honor people's consent and choice around that. Like I said, I haven't been around for the whole 25 years of NCHA's history, but I've been in public health for a decade or so. And I think we will continue to see an immense need for support and care and just loving our friends and neighbors and family members who are using substances, who may have a substance use disorder or might just need some help and someone to talk to decide for themselves if or when they're ready. Anyone in our community can develop a substance use disorder. There's still a lot of feelings. There's still a lot of misinformation. So I would say this is where we would love to partner. If people have questions, if people want to understand more about why we provide the services we do, we'd love to chat. We'd love to partner. We'd love to educate and raise awareness around how powerful it can be to, once again, keep people alive so that they can seek treatment and recovery. Because what I do know is they say about 1 in 10 people have a substance use disorder, which means it is very, very common. So there's a lot of myths and stereotypes around who that 1 in 10 is. The truth is, it is our neighbors, it is our family members, it might be us, ourselves, and it crosses across any sort of identity. And I continue to see the Larimer County community show up for mental health and substance use care in a way that's amazing, and I think can be a model for other communities. I think, once again, other communities do have different values, and Larimer County values mental health.
I think just the way that we support people is really what's changed. I took some notes before coming in here and just really tried to look at the things that Larimer County has done. And I think, one of the most pivotal moments was really introducing like a collaborative approach to helping folks that struggle, and also introducing lived experience, right? So bringing in folks with lived experience to really kind of help alongside data, like decide what could be best for folks. And also really introducing harm reduction. In Northern Colorado, I think we do a really good job. There are so many different options out there for people who want that support. It just really depends, again, on that person-centered approach. So really finding out what's going to work for someone, whether it's inpatient treatment, outpatient treatment. And even if the person doesn't know, just getting them in front of like a peer to connect and start having that conversation really can open up pathways to what kind of services are out there.
Have you seen any trends in overdose deaths or substance use in the last few years that have surprised you?
Surprise, no. Obviously, even at a national level, overdose trends are starting to go down. But what I want people to remember is that the crisis is far from over. I think a lot of the reasons why overdose trends are going down is that folks are getting access to the support that they need and the tools like harm reduction tools that can help them be successful. But the single most thing that I think is the most beneficial and crucial, and I'll probably keep going back to it just because of who I am, is introducing folks with lived experience into the behavioral health workforce. If we're comparing substance use journeys to going to the gym, right? If I want to lose weight or I want to build muscle and I go to the gym, I'm probably going to need to work with a personal trainer, someone that can help instruct me on the things that I need to target and the areas that would work for my goals, right? And so it's no different when it comes to navigating someone's recovery journey.
How do all of those organizations come together to wrap around an individual's journey through recovery?
My experience has been really working alongside problem-solving courts. I think they do a really great job of trying to stay in their lane and also be present to try to work through whatever type of sentencing that somebody has for their crime. Now, that's just in the more criminal justice side of things. But I think that, NCHA's bread and butter is really doing a collaborative approach, right? So when someone comes and wants services at NCHA, we do a whole assessment with them and then try to do the outreach to the places that will align with the services that they need. So for instance, if we're not talking about substance use, somebody comes in to visit with a care manager. Care manager will do that assessment with them and say, for instance, this person doesn't have a primary care provider and they haven't been to the dentist for a long time. And they think they might need glasses, but haven't had, a visit with a vision provider. We'll go through and make all those necessary referrals for folks and get them connected to the places that will take their type of insurance and all of those things. So I think that we as an organization do a really good job of that. And I think other organizations, especially in Larimer and Weld, have learned that this comprehensive collaborative approach is really what works best for folks.
We're all connected, right? A lot of times people need things that can't be met by healthcare systems. And so we're always interested in partnering with anyone interested in supporting people where they're at and supporting people with substance use needs. We have our board, which is a lot of healthcare, social service, and public health organizations. We are cross-sector in that way. You can find a list of our board members on our website, but that includes the local healthcare hospitals, that includes local public health departments, human service agencies, nonprofits that feel like they have a stake in the healthcare space or want to support or are supporting. And then specifically, some areas that we love to partner with is embedding peers into local emergency rooms. We have peers that are also embedded in Firehouse, for example, because they do a lot of community response. So we have some different embedded locations. We're interested in partnering with, directly where people might need support. So for example, Colorado Health Network is a big partner that we work with. If people walk in the door and they need help with substance use care or getting connected, that's where NCHA wants to be.
How does stigma impact this work?
It shows up, unfortunately, everywhere. How I kind of think about it is in different segments and layers, because a big piece of it is institutional stigma. And that's the way that prejudice or bias against people who use substances are baked into our policies and the way we do things in healthcare, in public health, in government services. It's very silent and insidious, but it has a huge impact. That also is, I think, related to provider stigma. In the data, in the stories we hear, a lot of stigma is from the actual providers themselves caring for people who have a substance use disorder. And then we also see, different types of stigma, like how drug use or substance use is portrayed in movies, in TV shows, in all sorts of things. It's either kind of shown as this fun party, everything goes well and we all have fun. There's also a lot of societal narratives around people who use drugs that are very telling in terms of how our society views substance use and substance use disorder. And so I would say all these layers contribute. And then the one that I think also we need to talk about is the internalized stigma, the shame that people feel because of these institutional and cultural messages can really show up in terms of people not wanting to seek treatment, even if they want it. It really can delay care. It can make people hesitant to seek services, especially if you do go ask for help and then your provider might be talking to you in a way that makes you feel like, really bad about yourself and discourages you from continuing to seek treatment. It takes a lot to advocate for yourself in a healthcare setting, regardless. And when dealing with something that society tells you is bad and that means you're a bad person, it can be even harder to continue to show up for yourself.
Are there steps that you would recommend to an individual, to help kind of reduce this stigma and better support those impacted by substance use?
Certainly educate yourself. I think there's a lot of community messages out there around this topic, particularly Changing Minds Larimer. That's actually a local campaign to reduce stigma. They have a website, they have social media, and they also talk about the brain science behind substance use disorder, because for some people, it is important to understand the clinical, chemical things that are happening in a body, because that's where this myth around it being a choice can really be dispelled. A lot of times, substance use is not a choice because your brain has been trained to crave that substance, and then it becomes the thing that your brain actually needs to survive. So it actually shifts what people are looking for in order to get through their day. I also think it's really important at a systemic level to challenge those systemic pieces of stigma. What kinds of questions are we asking patients when they walk in the door, or clients? How are we asking them? Have we ensured that our providers have been educating themselves and understand some of the challenges that people with substance use disorder face, or some of the things that might have happened to them, in order to then understand why they would medicate or go down basically that path? So I think there's many things that people can do, but education, awareness, and empathy can go a long way in terms of dispelling stigma.
Yeah, so I really think that the most powerful thing to reduce stigma is storytelling. So having folks come in, and it can be a very powerful tool. A lot of the times, people who don't understand substance use, they think that it can't happen to them or to the people that they love. And so really kind of sharing stories and really normalizing that substances are always going to be there. Like, we can't really ever end overdose, even though that's the goal, right? Substances are always going to be there. So the more that we can normalize it and just share that experience, strength, and hope with people, I think that we can change minds at a community level.
Is North Colorado Health Alliance doing anything in recognition of Overdose Awareness Month?
Overdose Awareness Day is actually August 31st, but we are celebrating Overdose Awareness Day and remembering Overdose Awareness Day on Saturday, August 15th at Library Park in Fort Collins. That will take place from 12 p.m. to 2 p.m. And then the next day, you can join us again in Loveland and Greeley. So on Sunday, August 16th, we will be at Dwayne Webster Park in Loveland from 11 a.m. to 1 p.m. And then we're jetting over to Greeley at Lincoln Park from 3 p.m. to 5 p.m. I am nervous about that transition, but we always make it work. It's going to happen. It's going to be great. And then we will actually be in the Estes Park community on Wednesday, September 2nd at Bond Park from 4 to 7 p.m. So Larimer County folks, your local community overdose awareness days are in Fort Collins on the 15th and then Estes Park on September 2nd. And we'd love to have you join us. We're going to have some remembrance activities. We'll have storytelling. And then we will have a lot of healing services, including some massages, some yoga, and other things. And then we'll also have a bunch of resource booths. We'll also train people how to use naloxone.
If someone is struggling with substance use or knows someone who is, what resources are available to them for support?
At a national level, folks can always call or text 988. It's pretty much the 911 for mental health services. But then we would also love to invite community members who are struggling with substance use to get a hold of NCHA. We actually have a treatment support and referral hotline available 24/7 every day. And you can call 844-944-7529. If you go to our website, you can also submit an electronic request for support through our portal. So folks would click on that link and be able to request some help that way. And then you can also walk into our NCHA locations. In Larimer County, our location is at 302 3rd Street in Loveland, Colorado. And then we also have locations in Evans, Colorado, and Sterling, and both are listed on our website.
What words of encouragement would you give them, or what kind of advice?
Don't give up. Like, I myself, like I said, I'm a person in recovery, and I probably didn't realize the stress and things like that I put on my family until after I've been in recovery. And now I have had some loved ones that have struggled. And even as a professional, I don't have all the answers, right? And I really just want to stay the loved one. I really just want to stay, a family to this person and not have to, go into peer support mode or navigating resources. Of course, I know there's resources out there for them, but just don't give up. And there are, resources out there for the loved ones to help them take care of themselves while they try to encourage their loved one into, a different journey.
If listeners would like to learn more, get involved, or support NCHA's work, where can they go?
We have a website, www.northcoloradohealthalliance.org. And I would also encourage folks to follow us on our socials. We are revamping our social media presence. And so I think this is a really good opportunity to get more engaged and to follow us, including we have lots of events throughout our entire region.
Awesome. Thank you so much for joining us today.
Thank you so much. I really enjoyed hanging out with y'all and talking about something I'm passionate about.
Thank you. I really appreciate the time, and I hope I see you and other folks at our overdose awareness events.
You can find links to learn more about the topics we discussed today in the show notes. If you have a question about public health in Larimer County or a topic you'd like us to discuss, let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.